Hello, good afternoon. Welcome. There, I see a couple of people. Hello, hello. Good afternoon.
Good afternoon.
Hello, hello.
Hi. Thanks for joining our meeting today. I see somebody else with the name of Nancy. Hello, Nancy. I am Nancy Hafer. I am the director of the Resource Center for Family Focused Practice here at UC Davis, and I'm really excited to be here. I really cannot tell you how much I appreciate the work of the qualified individual. And while we know this might not be the most exciting topic that we talk about when it comes to the qualified individual, really appreciate you all being here because the qualified individual is just such important work. Couple of quick notes. I know I'm talking slowly because I know people are joining and getting their audio all put together and coming online for this meeting. How many people just ended a meeting like 2 minutes ago? Yeah, it's exhausting, right? It is.
I'm kind of in the middle of one. I have to leave this one and go back to that one.
Yeah, I'm kind of doing the same thing. Actually, I'm actually kind of doing something similar. So just maybe take a minute to land here in this meeting. It's hard when we're just going from one meeting to another. There's some really wonderful things that we have been able to do in the last several years, and it's also takes a toll when you're bouncing from one meeting to a next. So again, welcome. I'm Nancy Hafer. For those of you who have just joined, I'm Nancy Hafer, the director of the Resource Center for Family Focused Practice here at UC Davis. If I haven't met you yet, it's nice to meet you. We are here to talk about the portal and how to upload information into the portal for the qualified individual activities for the title is very long for this webinar meeting, but it's the data collection process and how you all can help us make sure that we're collecting the data that we need with CDSS. I would love for all of you to let's get the chat warmed up. Thank you, Julie, for getting us started. I'd love for you all to add in your name, county, agency in chat. And if you are the qualified individual, we'll give you some extra love. So add that you're the qualified individual and we'll make sure to put a big heart on that one. Not the QI. Thanks for being here anyway, Stacy. We're really glad. Anticipating that because we're talking about data, we might not have as many qualified individuals as we typically do. So thank you all for joining. That's helpful for us to get a sense of where everybody's coming from. Quick, thank you, thank you. I see Calaveras is here. Nice, Mountain Communities. I love that. Ventura. So we've got Humboldt. Ooh, I wonder if we have anybody from the tip top of the state to the very, very bottom. I think I saw Imperial County. Ooh, we've got Imperial County. Do we have Siskiyou in the house? We've got Humboldt. Do we have Del Norte or Modoc or Siskiyou? That would be fun to go from the top to the bottom.
Should have Del Norte.
Say that again, Bill.
We should have somebody from Del Norte.
Oh, good. Awesome. Excellent. Oh, we've got San Benito in the house. That's great. Rachel Swaikos, UC Davis. That's fun to see you here, Rachel. Thanks for being here with San Diego. Okay, I am going to pretty quickly turn this over to Bill because Bill is the qualified individual leader with the California Department of Social Services, who has really been incredibly instrumental in making sure that qualified individuals have the resources that they do. So we're really happy to have you here, Bill. And I'm going to kick this over to you. We have an hour for today. And if you need anything, Bill, let us know.
Great. Thank you so much, Nancy. And thank you everyone on the call, on the webinar. Just real quick, again, my name is Bill Moore and I am with CDSS and I'm the program specialist lead for the state for the QI work, and this data collection piece falls under the QI 4E timeline requirements that we'll be collecting for. So I appreciate everybody being here. I'm going to go ahead and start off, and I'm going to share my screen, and it's going to be an email directly from CDSS that will grant you permission to the website, the SharePoint site. This will only come to those that are approved and have taken this, attended this webinar. We will be recording this webinar for future use for those that were unable to attend, or if the county has people that transition off and need to have new people input data. So again, this is the website or the email, and I'm going to go to the website right now. Just a SharePoint site that CDSS has set up. This will be the home page that you will see. If you go to data reporting, this is the site that will show your county's data that's been input. So it will show all of the pieces, all the data items that you guys have already put in there. And then to enter a new one, all you do is hit new.
Hey Bill, I'm sorry, real quick. It's Andrew here.
Sure.
Yeah, there's just some test data that you saw there that will be cleared out when we actually start testing and get live.
Yeah, so this is test data that we have that is administrative test stuff. So each county's will be blank until somebody actually inputs a survey.
Bill, really quick question. This is Linda from Sacramento County. The data points that you've chosen, are these the data points you're going to be asking for every county to, because I'm already tracking all of this, so I'm very happy that I actually did this, but thank God I'm telling myself, I've been tracking it since day one, like everything, all of this stuff. But so is this all the stuff you're going to be asking for? Will you guys send us this list beforehand of the stuff so I can make sure I've been tracking all of this?
It's actually listed in the ACL.
Okay, so that's what I've been. Okay, cool.
Yeah.
Cool.
So
Okay,
if you look at
I
ACL, there's a footnote and it gives you each of the different data points that will be on this form.
Okay, perfect.
Yeah. So thank you, Linda. And again, one of the things that a lot of people might be wondering is, where will you get this data? Well, counties since 2022 have been required to start to track this data. And so your county should be tracking it. It's a matter of where it's at or who's tracking it for you. The other way that it can be done is that in CWS CMS, the QI assessment report should be uploaded, and all of the court information for the STRTP court date should be in CWS. So you can go right in there and pull this information right off the assessment report and right off the court information.
Yes.
So, okay. Well, let me go ahead and start here and show you. So this is the new item. This is just a survey. It's just a quick thing for everybody to fill in. You'll hit your county. I'm just gonna Alameda, your top, and then you put in the client number. And I'm just gonna put in something right now. That's not gonna be the correct one, of course. And then basically what you do from there is you are starting. You could even at this point submit and go back into it later when you're able to have all the information or have more information. So I can go back and it will be here on my list. And I can go in and I can edit that. So if I start it and I don't have all of the information that I need, then I can save it and go back into it. So what I'm going to do is just kind of walk you through an emergency placement into an STRTP. So we have, sorry.
Oh, no worry. Don't worry about that. That's fine.
Okay. Okay, so I'm gonna go in here, I'm gonna do placement date. So let's put in, I'm gonna make it easy for myself. Let's go May 1st. So placement date is May 1st. Based on guidance, after the emergency placement, there needs to be a CFT. So let's put in a CFT date of the next day. The referral date, we'll put in after the CFT, we'll put in on the 5th. This referral received by the QI, that date won't be, that you'll see that on the QI assessment report. You won't know that until you actually look at the report. So we've got placement date, we've got meeting date, and we've got referral date. So then they've got 30 days from this placement date, since it's an emergency, to complete the QI assessment. So let's say I get the assessment completed on, let's just say June 2nd. Assessment's completed, that's the sign date. You get it also on June 2nd. This actually, because we've got the assessment, this we can put in that the QI received it on the 6th. The QI assessment made a determination of family-based setting. Because this is an emergency placement, there needs to be a court date within 45 days, but no later than 60 days from the placement date. So let's put in, I'm gonna put in 17. And then the court approved the STRTP placement. Now, here's where it gets a little tricky. Because the QI recommended family-based setting on June 2nd, that means that the county has 30 days then to move the child. So this date moves from, has to be before July 2nd. So if we put that, then we can submit. Now, if this is an alternative setting, then this date doesn't have to be here unless the court says, unless the court disapproves. So some of this information you won't need, only if there's some disapprovals.
Bill, quick question.
Mhm.
Because sometimes, you know, some of our youth don't step down in the 30 days like we would ideally like. Does this, like, it'll let us put in whatever date? It's not going to be like, you can't enter this date because it's not within the 30 days.
Yeah, no, it'll
Okay,
it'll let
cool.
it'll let you enter any date, and then on the back end, what we will be doing is tracking those timelines.
Okay. Now, for the youth that, say we have some youth that we actually uniquely don't do an emergency placement on, okay, but we do a QI referral, we get the assessment, it says home-based setting, so we will not have gone to court, we won't have any of that.
Right.
Will we still be able to go past go if we don't have that court and stuff?
Yeah, so let me do that. So let's do let's take out all of these. I'll take anyway, let's do a CFT meeting on 5/2, referral date on 5/5. There won't be a placement date. Let's see how that's going to work. Let me try to. There we go. Okay. Then we have the receive the assessment completed, agency, and then family-based. And then that will be all that you have to complete. You won't have this information here.
Okay,
And this will automatically say STRTP approval, but because there's no court hearing, this section won't even be looked at.
okay.
Does that make sense?
Yeah, it does. There are times though that, like I said, we go to court and sometimes we get a denial and we've already
Right.
moved them, but we'll have court. And so we'll tell you it'll be disapproved. So yeah. But that all makes
Yeah.
sense, Bill. Thank you very much.
Yeah, you're welcome. So basically that's it, folks. It's pretty simple. Then what we will do on the back end is we will look at,
Hey, Bill, I got a question.
oh, sure. Sorry,
Is
Matthew.
this gonna be, is everybody gonna have access to this, or is it gonna be selected by the county or whatever?
It's selected by the county.
Okay,
It's the
good.
people
Okay.
that we were notified and we sent this registration to. So if you got the notification for this registration and you're in this training, you will get an email saying that you are granted permission.
Okay. But it does sound like, Bill, from the looks of it, it would be a county, it would be potentially either CPS person or probation person, because I don't know if the qualified individual would know the
Well,
court determination and all that other stuff, right?
and
Yeah,
can I
that's
interrupt?
correct. It will
can I
be a county placing agency. for
Okay.
sure.
Well, the other thing is like, for instance, mental health takes care of a lot of this QI stuff, the information and stuff. So that's what I was asking that question.
Yeah, no, the mental health won't have access. It's only
Okay.
placement agencies requirements.
Which makes sense. And I track the whole picture. So that makes sense to me that we would, yeah. Okay, cool. Thank you.
Yeah, I see Norma's hand up.
Yes, hi. I just wanted to go back to where you mentioned, how on the court determination or order you put, it says approves STRTP placement.
Right.
And then the example that you were telling us was that they had, I think you had put on the dates that they were not approved, that they were going to go to a family-based setting. Why would we not put disapproved STRT placement? Does it even matter?
No, at that point it doesn't, because you're not even going to court if the QI says there's a family base. You still will go to court, but only if there's a placement. Like in this example, there's no placement. This was done all prior to the placement. If there's a placement date here, then you would go to court and you would need this date, and
Right.
you would need to have these approval or disapproval.
Oh, okay, because they're not even going to go to court. Okay, I was just thinking in my mind that it was just the QI recommendation saying they're not going to do it, so we're not moving forward. Okay, thank you for that clarification.
Yeah, so if the child is placed, then there automatically is a court date.
Right,
If the child is not placed, then it doesn't go to court.
okay. And I think there was a lot of questions in the chat that I had as well.
Okay, we'll
But-
try to scan through there. I see, Denard, your hand up.
Yes, thank you, Bill. One of the questions that I had, I know this is supposed to be effective 10/1. Is this retroactive in that the counties will be expected to have any placements in this spreadsheet starting 10/1, or is it any placements effective 10/1 onward?
Placements effective 10/1.
Okay, so any
Yeah.
placements starting on 10/1 onward need to be in here, but
Yeah,
placements prior to that, we don't need to.
right.
Okay, thank you.
And I see Solette. So I
It's
know
Cleette. Hi, Bill. My
Yeah.
quick question is, I'm in Orange County. We have a lot of youth that are in and out of placements. So for
Mhm.
example, say if I have one youth that goes into a placement, they AWOL, and there's a new placement episode with a new QI and a new SRTP, is that another submission for that youth?
Yes.
Okay,
Yeah.
thank you.
So each placement is a new form.
Perfect. Thank you.
Thank you for asking that question. I had the same question from Sacramento.
Oh, you know what? I gotta ask this question. Is that gonna be changed?
Is that going to be changed? What do you mean?
Yeah, I mean, because there are some kids that go from one placement to the next placement to the next placement, and this is all you're gonna be doing is QIs on the same child.
No, because it's federal requirement. We have no control over that.
It's what we've been doing since 2021.
Yeah, it's federal requirement and it's dependent, federal 4E funding for the placement is dependent upon it. Colette, did you have another question?
I do. One more
Okay.
question. We received maybe many months ago an ACL or ACN with using a time study for the QI. Anything has to do with QIs. Are we to use that same job study code to do all this information now?
Yes.
Okay, great.
Yeah.
Thank you.
So any claiming will be based on that CFL.
Perfect. Thank you.
And then last, Bill, are we putting CTF placements in here too because they're STRTP licensed?
Correct.
Okay.
Okay, so let me go back here. Okay. Or backdating, no. I see that. Can you delete one you started? Good question, Andrew.
Yes. I've been kind of answering some questions in chat.
Okay.
But yeah, if you create a record, you or anybody within the county should be able to both view that record, edit that record, and if necessary, delete that record.
Okay.
And if that fails, I mean, you could always reach out and we can always remove things, but we don't expect that to have to happen.
Yeah. Okay. Nicole, we're in spreadsheet that tracks all the information. Our physical team eligibility, behavioral health, view access. Option 2, this data for view access. I do not know that we'll have view access. I see, Andrew, you kind of mentioned we will be exporting the file, the thing
So,
down to.
The way that SharePoint lists work is you'll be able to export basically what you see is what you get. So as folks begin entering records into the portal, it'll be filtered by the county that they were assigned to. And the view that you'll see is basically just a list of your county's entries. There should be an export button on the main list that will basically just churn out an Excel spreadsheet of the entries that your county has made. So basically this table here, but in Excel. Yeah, that little export button right in the bar.
Yeah, so this will export all of the county's entries into an Excel sheet.
And Andrew, sorry, that was my question. I also asked the question about like a notes field. If you added a notes field, this would just be like at the end of the spreadsheet as one of the fields.
Yeah, it's just gonna be an open, just a giant text box.
Perfect. Thank you.
Bill, I'm not sure if this question was answered. Is the client ID what is used in the CWS, CMS, or the ID assigned by the QI's process?
It's the client ID from CWS, CMS.
Cool.
Yeah, so it's what, a 16, 17? I forget how many numbers it is, but anyway, it's the CWS number.
Okay.
Quick question about that to you, Bill, from my end. Is this just a straight numeric or is it alpha numeric?
No, it's straight numeric.
Okay, gotcha. That will, all right, I'll probably be editing the data type on that just to speed up a bit of processing.
Okay.
Okay, you want me to read you the next question, Bill?
Sure. Thank
Okay,
you.
I've got Rachel. I don't think this question was answered. If the court approves the CFT and the QI recommended an alternative placement, do we still select court approved STRTP placement, or will CTF be separated out?
You would still do STRTP.
Okay, I'm putting that in chat.
Yeah, because they're a licensed STRTP. That's how they're licensed. So
Okay, awesome. So I'm just going through and adding the one word answer to the end of that question. Okay, did I hear correctly that we will fill this in even if the child is not placed?
yes, you'll just complete the referral, the assessment completed, and receive, and then what the QI assessment determination was.
Okay, we've got one more well, we've got a couple more. Can you provide the CFL number?
Oh, yes, it's 21 /22-51.
Okay. Backslashes are hard for me, so I did 21, 22, 51.
51, yeah.
Okay.
And
That should
actually,
get
the other one, the claiming one, is 21, 22, 34. So there's
Okay.
two of them. The CFL for the 51 is the one that talks about the data collection. The 34 is the allocation one. That's the first one. Now there is one that's a recent one that I don't know the number offhand. Sorry.
Okay. And I don't even know what that's not a backslash. That's a forward slash, I believe. I tried. Okay. Let's see. Andrew answered the next one. Well, okay, so this one, oh, Andrew said he would defer to you. Okay. Michelle started the question that several people added some additions to, but is it better to wait till you have all of the information available or enter an update as time and processes unfold?
That will be up to you guys. It
Okay.
doesn't, yeah, it's totally up to you, because you can go in and submit and save what you've already got in there and then go back in and edit it.
Okay, so per bill, up to you.
And then Michelle, I see your hand up.
Yeah, my reason for asking that question is because I kind of wanted to know, like, is there a drawdown from the state side where there's like a deadline we should be having ongoing information added for their reporting purposes?
No, basically what we'll do is once a full one is completed and we have all the information, we'll pull it periodically to gather that information.
Okay.
Okay, so can I clarify, there's no timelines for the reporting, Bill? I think that makes it sound like there's no timelines.
Yeah, the only timeline would be that once you have after say 90 days, say the kid's placed, you have the QI, they say STRTP, they go to court, they say no STRTP, then they have 30 days after that to move the child. So technically it would be a 90-day period that you would have to complete that whole process and fill in everything before you get any information. I mean, all the information.
Is
Okay,
it possible, Bill, that before you guys at the state pull, that you could send out an email to all of us counties to be like, hey, we're going to pull data on this date. Could you make sure you input what you can through that date then?
Yeah, we could do that.
And
what about if it's a pre-placement?
What do you mean a pre-placement?
I don't know, that was the question. Sure, Sherry?
Yes, thank you. So we try to get our workers, like when the kids are like in Harmony Haven or they're at hotel at an outstation, we try to get a pre-placement for those kids that we know are going to be in a placement at STRTP. So the recommendation could be there before the courts, if that makes any sense.
No, so they're in like a temporary shelter.
Correct. You could say that, yeah.
So the temporary shelter, while they're there, you could do the QI assessment or start that process. And then once the child is placed, then that would be your placement date into the STRTP.
Okay. All right.
And your timelines would start from there.
Okay. So we don't need to do a whole new QI. Okay.
Not
thank you.
with a shelter, only for the STRT, only for an STRT placement. And Colette, I see your hand again.
Thank you, Bill. Last question, I promise. So
No worries.
our QIs usually say approved for SRTP or not. We don't use family-based setting or alternative setting. So which is considered SRTP approved? Does that make sense? Is it considered alternative setting or family-based? I'm not a worker. I just
Alternative setting would be STRTP.
perfect. Thank you, sir.
Basically, the QI determination is supposed to determine if the needs can be met in a family-based setting, and if not, what's the alternative setting for them.
Thank you, Bill.
You're welcome.
Okay, so the next question is, can you repeat the CMS-CWS report again?
Repeat the CMS-CWS report again. Sorry, Mike, I don't understand.
I thought I caught that there was a report in CWS CMS that we could pull.
Oh, the QI assessment report. So once the county placing agency gets that from the mental health, the QI, that is supposed to be uploaded into CWS.
Okay.
And so from there, then you can go into that. That will have the date of the referral. It have the date that the mental health plan received it. It'll have the date it was completed. It'll have the recommendations from the QI. Does that make sense, Mike?
Yes, thank you.
Sure.
Excuse me, I'm sorry. I didn't mean to interrupt. Can I, with Mike asking that question, is there going to be a spot on this database or SharePoint that we can upload the reports as we get them from behavioral health?
No, it's right in CWS. Yeah.
Okay. All right. Just asking because we do ours on our site. Okay. No problem. Thank you.
You're welcome.
So Bill, you're just saying that the actual report, just import that into CWS, right?
Yes, that's the way, since the original guidance came out in 2021, everybody, you're supposed to be uploading them into, and if you look at ACL 21-113, that will give you the platform, or the way it just goes into the document section of the notebook.
Okay, so I'm pretty sure I know the answer to this, which I think is yes, but there will be written direction of how to log in and input data.
Actually, there won't be written direction.
Oh, I was wrong. Okay.
You will get an email after this for attending this webinar. You will get an email saying that you're granted permission, and click on that link to the site and it will go there. So I would suggest, once you have that email and you go on there, to bookmark it. So then you can go back easily into it. And when you go into from that, this will be the screen that pulls up.
Okay, Bill, I'm sorry, I gotta ask this question.
Sure.
So in CWS, right?
Right.
The same kind of data you're entering into the state database, you said you can do that into CWS too, or is it just the whole report?
No,
Okay.
it's just the whole report.
What about the new system coming out?
The new system, once CARES Live or CARES CWS CARES goes in the live in 2026, this process will no longer be needed, because all of this information will be uploaded.
Okay, that makes sense. Okay,
Yeah.
now I get it. Okay.
Yeah, so you're off the hook in a year and a half, or a year. Maria, I see your hand.
So who was responsible for uploading the document, the QI report, into CWS CMS? Is it the placement agency or the
placing agency? Because the QI, the behavioral health, doesn't have access to that. Or most of the time they don't. Sometimes they do, but most of the time they don't.
But most of the information you're probably going to get from mental health, because they're doing all this.
Right.
And then you mentioned also that once CWS CARES Live comes into, because we're a pilot county, so we're already utilizing it. once that goes into effect, we will not be able to, we do not have to do this process, you said?
No, once CWS Cares goes live, not
Okay.
Cares Live, not the current platform. Once the full phase one goes into play, I think it's October of 2026 is when it's supposed to go in, become active. And then at that point, all of this information will be required to be put in by the social worker, and we'll be able to access it right from there. Yes, I agree, Colette. Okay, Norma, I see your hand.
Yes, could there be multiple users per county?
Yes.
Okay.
There can be multiple users. I think, Andrew, correct me if I'm wrong, but at least 5, if not more.
It supports unlimited users per county. It's just provide us a list of the users' email addresses and all that, the county that you're affiliated with, and we will get it set up for you.
Thank you. Oh, so you'll be my contact person, because my thought is that if I had to have like somebody leaves because we're going through a lot, then I would have to get a replacement, just contact you with that replacement person.
Yeah.
But I wasn't sure like who and what.
Yeah, actually, I will be the contact person.
Okay. Thank you,
Yeah.
Bill.
You're welcome. And I'll make sure that you have my email and everything before.
Oh, great. Thank you.
Sure. And then Elizabeth, I see you.
Yes, hi. So we've had youth placed in STRTPs that have like multiple locations within the STRTP. So it'll be like different homes, like addresses in the same vicinity. So I'm wondering if when a youth is transferred to one of the new homes, if a QI has to be done, even though it's the same STRTP, it's just like a different building. I don't know if vicinity is.
Yes, if it's a different license number, it's considered a new placement.
Okay, gotcha.
Yeah.
Okay,
Thank
here's one. Ready, Bill? Okay, so some kids due to the behavior, like some STRTPs just don't accept them, and so they end up going to a group home, which is not an STRTP.
Group homes do not receive federal funding.
Okay.
So you're not required to do any of the FFPSA, QI, or court process.
Got it. Okay, thanks.
Sure. Yeah, this is basically FFPSA only relates to 4E funding, and the requirements only pertain to that. I've seen Nicole, and then Nancy, I'll let you go through and ask some more.
One thing I may have missed, but I didn't see on the tracker that we track is whether or not the facility is accredited. Because even if they're not accredited, we can still go through the process and receive funding for a certain amount of days if the entire process is approved. So did I miss that there's something in there that asks whether or not the STRTP is accredited? And if not, will it be added?
No, that piece will be done by your eligibility folks. There's flags that they put into their eligibility and send it to the state, and we flag them so that money that gets pulled out. Yeah.
Thank you.
Sure.
Okay, there is a question that assuming this includes probation placements, and will they also be granted access?
Yes. All placing agencies, so child welfare and probation. That's why we've got probation folks on here.
There was a question in here. Can staff who were unable to attend watch the recording and then get access?
Yes, what we'll do is once we do this, they can contact me, and I will send them the link to the recorded webinar, and then once they watch that, then they will be granted. They'll be sent an email with granted access.
Awesome. Stephanie, hey Stephanie.
Stephanie.
Hi, I know I probably shouldn't even be on here, right? I figured I'd pop in. I have a question because these are great questions that have come up. And, Bill, I know originally with Family First, there was a lot of questions that came in, right? And so some of these are probably already answered on the website with process and everything to meet the QI requirements. However, for the data collection, are you going to create something a little bit similar? Like if you see a theme of the same questions coming in, that would be helpful for those that are doing the data entry to make sure, it's consistent, the data that you
Right.
are getting.
Right, so like an FAQ
Yeah, something like
for
that.
okay. Yeah, I hadn't thought about that, but that's probably a good idea. We can probably take questions in the chat and pull those out and then draft up an FAQ.
Probably helps your inbox too, right? With the inquiries.
Yeah, I'm sure. 'Cause, yeah, that inbox could get pretty compacted or
Thanks.
impacted.
I think, Bill, a good example of like what also might be helpful in writing, if you guys do write anything up, is like when you were sharing your screen and going over how you would enter information into the different fields. When it asked last CFT, my team and I had assumed when we read the ACL that meant even for an emergency placement, you guys want us to put the last CFT happened before the placement and not the one that's required after the placement. So I think like even defining what each of the fields, what you're looking for, so each county is actually putting in the same type of data would probably be really helpful. It was helpful to see you do it, but I think people would probably be more inclined to read what they should put there than watch the recording again.
Yeah, thank you. That's a good suggestion.
Here's a question. Does probation need to upload the QI reports for probation youth into CWS?
Yes, and Stephanie, remind me, we talked about that. I can't remember where probation was going to upload those.
I know currently right now there's oh goodness, I'm trying to remember if it's in the notes, the contact. I can take a look and see where it is currently right now, where I believe, I don't know if it's contact notes. I would have to double check and see, because probation, of course, has doesn't have all the same access as child welfare. So let me see, and maybe we can work offline because it may look different, in reference to this process.
Yeah, so what you can do is I will take that back, and Stephanie and I will, I know we talked about it in the past and we came up with a solution, but I don't remember. So
yeah, and that's I'm not as well versed in CWS CMS, but I do know for Family First, part 4, when a youth is recommended, because originally, currently right now, how can I say it? With the implementation of October, of 2021, probation was required to be part of this, but also enter the data in for if a youth is going to be recommended into an STRTP. There was some information that would need to be uploaded, and I think there was a workaround. I just got to see.
Yeah.
I'll double check and see, but yeah, Bill and I can
Yes.
hotline.
Yeah, so those from probation will make sure that you get that information and where to upload it and how to do that.
All right, we've got another question, which is just what's your email address so people can email you a question, or what email would you like to have in chat?
Yeah. I'm gonna go ahead and put mine in there, and then they can email me, and they can also, I'll put in the Families First one, which is the I monitor also. So that's FFPSA. So either one of those emails will work.
Cool. Hey, Sandra.
Oh, good afternoon. I just have a quick question. So we've got a placement unit that's going to be entering a lot of this QI data into the portal, and they each have their own login. When they log in, they're going to just be able to see like our county and be able to, we can update each other's entries, stuff like that. Just wanted to.
Yeah. You'll, once that initial screen we've got it filtered so that whatever the county address is on the email, it will automatically upload it to that county. So you will only see on, I'll show you the screen. So on this screen, you will only see your county's upload or surveys.
Okay, perfect.
Good.
Yeah, yeah.
Oops.
Yeah, we wanted to make sure it was private so that you could only see your county and nobody else could see them.
All right. Does anybody have any other questions?
Oh, yeah, I just said, I just looking, Alicia from Contra Costa, yeah, it does seem pretty straightforward, but if you needed support, just email me at either of those email addresses and we'll make sure you get taken care of. And then I do see, Mary, that your supervisor registered but was unable to attend. So what we'll do is once the recording gets put out, we'll send that. I'll have her notify me. We'll send the link for the recorded webinar. And then after that, after she watches that, then we'll be able to grant her access from her email. Yes, and thank you, Alicia. I see you put in the UC Davis FFPSA website. There's all kinds of information for QI stuff. There's questions in there about STRTP placements. There's FAQs that some of you guys might be able to use since you're all mostly probation or child welfare. And if there's ever any questions about the process or what your requirements are, feel free to email either inbox myself or the FFPSA inbox, and we'll make sure we get you an answer.
I was going to ask the question that's on the chat. So if, for example, you were registered, but you weren't unable to attend, are you automatically going to get the recording of the presentation or the training, or do we have to send an email to one of your emails and request a copy of the recording?
Yeah, what we'll do is we're going to take the attendance list from this and I'll match it with the registration. And if people didn't attend, but they were registered, I'll contact them and make sure that they're still going to do it and then send them the link. So we'll take care of all that on this end. And yes, Michelle, you all will get a copy of the link to the webinar so that you can refer back if you want.
Also, I just wanted to add in a couple of things here, just looking at the portal from my end. That sidebar on the left there is probably going to be squished out or just outright removed, since the only thing you'll need to interact with is this list and the form itself. And then the home page will also probably be changed from the SharePoint default, which is what it is now. So we'll just make it more attractive and informative.
Yeah, a little more easy to navigate. Thank you, Andrew. Okay. Any other questions? I'm glad I'm glad we went through it quickly, because I wanted to leave as much time as I could for questions, because I knew there would be some. So, and again, if something comes up and and you have a question, just please email me. Well, thank you, everyone. Thank you. See all the things in there. Thank you. And if there's no other questions, I guess we'll let you have a few minutes back. And you guys have a great rest of your day. And I'm sure we'll be talking sometime soon.
Thanks, everyone.
Thanks all.